Hi there. As was mentioned, my name is Gabby and I work at Shatterproof. We are a nonprofit organization that is committed to addressing the addiction crisis in the United States. And my team and I have a specific focus on stigma, and that's what we're going to talk more about today. So here on this slide, you can see three different buckets of stigma that we've identified at Shatterproof. We actually talk about four, so I'll make sure to highlight all of those. But the first is public stigma. Here we're talking about society's negative attitudes towards a group of people, and it can create an environment where people feel unwelcome, judged, or blamed. Another part of public stigma, that extra bucket that I mentioned, is stigma against medications for opioid use disorder, or MOUD. And this is really the idea that some forms of treatment or recovery are seen as more acceptable than others, or carry more or less stigma than others, and that falls within public stigma but is recognized separately. Second, we have structural stigma. Here we're referring to systems level discrimination, and this can be caused either by an institution's policies. So maybe things that are codified or written down, maybe something you'll find in your employee handbook, for example, or it can also be related to dominant cultural norms. So more of like following the status quo, things that you wouldn't find written down anywhere, but everyone kind of follows and knows are part of the culture. And then both public and structural stigma will interact and can lead to self-stigma. And this is where an individual will accept the societal stereotypes that are laid out and can experience a reduction in self-esteem and self-efficacy, which is important to address because both are vital if we're going to talk about treatment and recovery. But overall, no matter what bucket it falls in, stigma manifests as discrimination. It can dictate how policies are created or if they're created, how healthcare is provided, and if it can be accessed, and same with treatment. And it can lead to deep feelings of exclusion and shame for people with a substance use disorder, as well as lead to negative health outcomes. Talking more specifically here about stigma in healthcare, we are going to have a conversation about some individual level changes that you all as providers can make to support your patients with substance use disorder. However, I do like to highlight that the system is not designed to support individuals with SUD or providers who are treating patients with SUD. While we've come a long way in the last decade or two, there's still a lot of work to be done. So again, going to be doing a focus on individual level change and language, but there is more that needs to be done to support everyone. But the reason that we do this focus on individual level change is that we know that exposure to stigmatizing language in a patient's notes can be associated with more negative attitudes towards that patient, as well as with a less aggressive management of that patient's pain. We also like to highlight that access to treatment and care for anyone with a substance use disorder is likely to lead to some type of stigma. However, this can be even more challenging for people with different individual identifiers. So here on this slide, we're talking about the Black, Indigenous, and people of color communities. But this also we can also see stigma based on somebody's sexual orientation, religion, size, any other identifier for that person that might be different from the provider can lead to stigma as well. But overall, we do know that attitudes towards individuals with SUDs can be improved even after just taking one online training module. And so that's why we're going to talk more about language now. So an example here on this slide for how words shape the way we view people and how we treat them. There was a study done with over 500 clinicians that were randomized into two groups. One group was asked to refer to their patient as an individual with a substance use disorder. So here we're talking about person first language, really highlighting the fact that that person is an individual first and foremost. And when we refer to their substance use here, we're talking about it in terms of a medical disorder, so a substance use disorder. And then the other group was asked to refer to their patient as a substance abuser. So here we're taking away that person first language, only referring to the individual in relation to their substance use, and specifically with that term abuser. And what was found was that the clinicians who used the term substance abuser were more likely to say that their patient was personally responsible for their illness and to support punitive action over treatment. So again, a real highlight of why language and this individual level change that we can make is really important when we're talking about health outcomes for our patients with substance use disorder. To help support these efforts, Shatterproof and similar organizations have language guides. So here's an example of some of the pieces you would find in ours. The last example is one I like to highlight to review. So you'll see on the left-hand side, there's the stigmatized or outdated term. So here we're using dirty or even clean. And then you'll get a less stigmatizing option that you can use. So either talking about a person who tests positive or negative for substance use, or a test that comes back positive or negative, would be a less stigmatizing way to phrase it. And then all the way on the right is a rationale. So using the terms dirty and clean are associated with filth as opposed to a medical condition, which to be less stigmatizing is where we would more want to align. And it can also invoke punitive bias or shame. So again, you get a less stigmatizing option and a rationale, and is a great way to support language change and a good reminder to have on hand. We also like to highlight this slide here too. While you are doing this work, while you are working with patients with substance use disorder, you may hear them refer to themselves or people in their community as some terms that we've talked about as being stigmatizing, like on the left. However, as members of the general public or as health professionals, we want to be using less stigmatizing language regardless. And we also want to make sure we're using less stigmatizing language in our patient charts and notes and in the conversations we have with our peers. But we don't want to make it our job to police the language of those that we are working with. Above all, we want to make sure that our patients feel welcome and safe in our presence. So again, we want to be mindful of the language we use, but don't want to be asking them to change their language. So a quick recap, some things that we can do to support this work. And the first would be adjusting our language. We also want to be learning the facts. So attending webinars like the one you're at today is a great way to do this, stay up on any language change and just get that refresher. We also like to highlight that doing this work doesn't just support our patients, but supports our families, friends, and communities as a whole. Because of that stigma we talked about early on, we might never know who is facing that stigma, who's maybe internalized that as self-stigma. And this work and these changes really allow us to see the person as a whole person and really benefits our communities. We also want to make sure that we're listening to people when they share their stories with us. So that could be in a verbal way, confirming what they're saying to us, maybe repeating things back to them, saying, oh, okay, here's what I'm hearing, and things like that. But it can also be nonverbal. So making sure that we're being mindful of how we show up in the room. Are we standing further away than we might normally stand? Are our arms crossed? How are we showing up physically? And then lastly is to speak out when we hear something stigmatizing. We want to be challenging misconceptions and stereotypes. This can be a little bit intimidating. However, there are ways to do it that are less confrontational. So maybe if someone comes back and says, oh, this test came back dirty, saying, oh, it came back positive for X substance. Great. Thank you so much for letting me know. So it doesn't have to be necessarily a combative conversation, but really ingraining that language change in our vocabulary can inspire others to do the same. And then the last slide for you here, we do want to highlight the work that Shatterproof is doing across the state of Pennsylvania. We have state campaigns in several states across the country, but in PA, that program is called Life Unites Us. On this slide on the right, you'll see an example from our story library, which is linked on the page. This is an opportunity and gives a platform to Pennsylvania residents who are affected by the addiction epidemic, and it highlights a need to replace stigma with support and understanding through this humanizing lens. So you'll find people here who have direct lived experience, who might have family members with lived experience, who are caretakers. And then we also have first responders, EMTs, and healthcare professionals. If you are ever interested in sharing your story or experience, we are collecting this type of feedback all the time. So would love to have you share your story with us, and it can be on our website. But that's all I have, and back over to you.